via motion field protection?
Yep.
Please.
Thank you. So, hello everyone, I'm Lin, and I'm very glad to present our work, Temporal Interpolation via Motion Field Prediction. So, radiation therapy is an important tool for treating cancer. In therapy, organ motion can cause inaccuracies in target localization. And respiratory motion is one of the most common motion sources. Therefore, respiratory motion modeling is very crucial for planning and guiding radiation therapy. 4DMI is widely used for quantification of breathing-induced motion. And one technique for free breathing 4D reconstruction is to use Navigator slice-based acquisition. So in that technique, data acquisition follows an alternating scheme between data slices of volume of interest and Navigator slices at a fixed level position. So the data slices are then sorted retrospectively according to the level position on the Navigator. However, dependency on the Navigator prolongs the total acquisition time. So to reduce time, but without sacrificing temporal resolution, we can take less navigators and interpolate the missing images by using deep learning techniques. And the previous work has proposed a simple convolutional interpolation network, and for short we call it a SC network, to interpolate the missing images directly in the intensity space. So on screen we can see an example image predicted by the SC network. So compared to its ground truth image, the image predicted by the SC network is quite blurry along the motion direction. And in addition, we can see the network has ability to change the image content. For example, it can remove vessels. So in this work, we have proposed a new interpolation method to avoid such kind of problems. So to the motivation of our new proposed method, we have acquired sagittal slices, therefore out-of-plane motion is rarely present. And we observe minimal change of image contents across time in the Navigator slices. So each frame can be viewed as a specially transformed version of its temporal neighbor. So therefore, we want to incorporate this prior knowledge, and we model the temporal interpolation as a two-step process, including motion estimation and image resampling. So we incorporate motion field estimation as an intermediate step for the interpolation problem. And we expect by this way, the network could produce more plausible images. And this leads to our new formulation of the interpolation network. We predict bidirectional motion field using convolutional neural net. So we have trained a network which takes several temporal neighbors as input and predict the bidirectional motion field between the image to be interpolated, the NT, and its direct temporal neighbors, NT-1 and NT+1. So and either of the both motion fields can be used to generate the missing image by warping the corresponding temporal neighbor. And in our work, we use bilinear interpolation as warping function. So the structure of the network, motion field interpolation network, we call it MFI network, is as follows. So as mentioned, network takes several temporal neighbors as input. The input pass through shared layers and diverge into two interpolation subnetworks. And each of the interpolation subnetworks estimate one of the bidirectional motion fields and generate the corresponding interpolated image. So the loss function used for optimization consists of two terms. The first term is reconstruction loss. So for the reconstruction loss metric, we use L2 norm and structure similarity index. And we optimize our network for both interpolated images. The second term is regularization term. We use total variation to promote smoothness in both motion fields except on motion boundaries. To have more plausible motion fields, network may require further regularization. And in registration problem, we know that cycle consistency is a very effective regularizer. And from our basic network, it can be easily extended to enforce cycle consistency constraint. So for that, we add an extra registration subnetwork, which estimates a motion field between the two non-immediate neighbors, NT-1 and NT+1. So now we have a new network structure, which is the MFIN network with the cycle consistency, and we call it MFIN C network. Now the loss function consists of 3 terms. The first is reconstruction loss term. We have here an additional term for the registration subnetwork. And correspondingly, we have an extra term in the regularization as well. So and last term is cycle consistency constraint. So with 3 motion fields, we are able to penalize cycle inconsistency here. So now in our work, we want to compare 3 different methods. That's the SSIN, MFIN, and MFIN-C network. And we have used several evaluation metrics to cover different aspects. The first category is intensity-based metric. So root mean square error is generally used in regression problems. It directly captures the intensity difference between the ground truth image and interpolated image. However, it is very sensitive to noise and can be reduced for denoised images. And furthermore, it is not robust to intensity scaling. Intensity scaling is relevant in Navigator slices because of saturation effect. In 4D reconstruction, we only care about the lever position. Therefore, shift intensity shouldn't be penalized if the lever position is correct. So the second is structure similarity index. This metric encodes local correlation, so we expect this could be more robust to intensity scaling. And however, it is not robust in the presence of noise. So the second category is registration-based metric. We would like to have some metric which can account for accuracies of anatomical positions. So for that, we first calculate the residual motion between the interpolated image and the ground truth image. We register 2 images by using a gold standard registration algorithm, and we compute the mean magnitude of the resulting motion field. And second, since Navigator slices are later used for 4D reconstruction, so it's very crucial to know the error introduced by the interpolation step. And in 4D reconstruction, each Navigator frame is registered to a reference frame to estimate the lever position. So we do exactly the same. We register 2 Navigator to the reference and the interpolated Navigator to the reference. And we compute the mean magnitude of the difference between 2 resulting motion fields. And we compute this metric over the region of interest, which is lever. And this metric should reflect error introduced by the interpolation step. And the last is landmark error. So landmark error is a gold standard evaluation metric, and however, it is very labeling intensive. So for that, we have manually annotated landmarks on consecutive navigators. So now the following 3 animations shows the interpolation performance qualitatively. And on the left-hand side, we can see the ground truth images, and in the middle, it's the ground truth images interleaved with the interpolated images by the SSIN network. So it will be the N1 is ground truth, N2 is interpolated, and 3 ground truth, and so on. So and it's the same on the right-hand side, but it's interleaved with the interpolated images by the MFIN-C network. So here we can clearly see that images interpolated by the SSIN network is quite blurry along motion direction, and we can better observe the boundaries here and here. And in addition, we can see that structures like vessels in liver and in lung appearing and disappearing. And in comparison, the MFIN-C network can almost preserve the information content. It can even preserve the noise texture. And in addition, here we can observe the saturation effect as well. So now it's the saturation effect. So here we can see some images corresponding to the introduction example. So on the upper row, we can see the ground truth image, interpolated image by SSIN, interpolated image by an MFIN-C network. And on the below row, we can see the difference image between the ground truth image and the frame after. So it will be NT and NT plus 1. I put it here to show you the motion. And in the middle, it's the difference image between the ground truth and interpolated image by the SC. So it's the difference image between the ground truth and the interpolated image by M-fin-C. So from the difference images, we can see that M-fin-C has improved results substantially, and however, it can still mislocate structures like vessels, like here. So here is an additional example where we can see structures can be better preserved by the M-fin-C network. So now I'm showing the motion fields corresponding to the introduction example. It's overlaid on the difference image between the NT+1 and NT. And from its motion magnitude map, we can see the motion field is quite smooth, and the total variation allows sliding boundaries here. So in our work, we want to compare 3 different networks, the SC, M-fin, and M-fin-C. And in addition, we have used 2 different reconstruction loss metrics. That's the L2 norm and structure similarity index. So this leads to 6 different combinations. And the following table summarizes all the numerical results. So the bold number means the lowest or the highest for the S-sim among different methods. We go that step by step. So the first category is intensity-based metric. So among this metric, we can see the S-sim with L2 performs well with respect to root mean square error, and with S-sim with respect to S-sim. So as discussed before in the evaluation metric part, these 2 metrics are sensitive to noise and can be reduced for denoised images generated by the S-sim network, whereas the images generated by the M-fin or M-fin-C network have inherited the noise texture. And the second category is registration-based metric, and with respect to residual motion, we can see the S-sim with L2 and the S-sim with S-sim still performs well, and residual motion can be artificially reduced for denoised images as well, because the denoised property can reduce the gradient of the image similarity metric optimized during the registration algorithm. So, and the next is the most 4D relevant metric. It's the error in motion to a reference over the liver. And with respect to this metric, we see the S-sim and M-fin-C with S-sim have very similar results, and difference is minimal. And the last is landmark error. So since we do not have motion fields from the S-sim network, we can only compare landmark error among different M-fin network setups. So if we compare the M-fin network with L2 and M-fin network with S-sim, we can see the network with S-sim has a lower landmark error. And comparing M-fin-C and L2 and M-fin-C with S-sim, they have very similar results. And if we compare the M-fin network with L2 and M-fin-C with L2, we can again see an improvement in performance with respect to landmark error with cycle consistency as regularization. And the M-fin with S-sim and M-fin-C with S-sim have still very similar results. So this means either using the S-sim as reconstruction loss metric or using cycle consistency as regularization helps to find more accurate motion fields. So let me do a short summarize. So in our work, we have proposed to incorporate motion field estimation as an intermediate step for temporal interpolation. And we see by this way the network can faithfully preserve the information in the images. So in addition, it can estimate bidirectional motion fields in an unsupervised fashion as byproduct. And this byproduct can be potentially used to halve the number of registrations required during 4D reconstruction. So it is the step when we register each navigator frame to a reference frame. And to the best of our knowledge, it is very new to introduce cycle consistency into loss function for temporal interpolation with neural networks in medical applications. Thanks a lot for your attention, and yeah, time for questions.
Thank you for this very interesting talk.
Thank you for your talk. Nice work. I was wondering, could you maybe elucidate what the difference might be of using cycle consistency or maybe using a mutual information metric to obtain your motion field or to do your registration?
Using mutual information metric. So I can't really answer your question because we haven't tried to use mutual information metric in our neural net for training. So
could you maybe in general then discuss what the difference might be or the between registration or using your cycle consistency? In which cases would you use this, for example?
Yeah, I think mutual information does not include information about cycle consistency. So cycle consistency would require 3 motion fields, and mutual information would ignore that information, as so far as I know. So, yeah.
Thank you.
Are there more questions? There's one in the front.
Oh, I'm first. Okay, you use 2D processing, right?
Yeah.
But it seems to me that you could gain a lot if you want to do this from extending into 3D, making it more general. Is that possible, you think?
Yes, it's possible to extend to 3D, and the problem I can think of is the memory. So in the 3D, you have larger volume, and you would generate just 3D motion fields, so it would allocate a lot of memory on GPU.
So the thing I don't yet understand is do you detect the breathing phase over repetitive respiratory cycles? Is that something that you exploit or not yet?
You mean that for 4D reconstruction? So it's free breathing, so it would compare the liver position to detect the breathing state, to use the liver position to do the 4D reconstruction. So you would stack the slices, data slices which have similar Navigator slices. Yeah.
We still have time for questions. Any more? Okay. I think in this kind of dynamic chest CT images, you have a lot of sliding motion, right, between the lungs and the rib cage. So can you elaborate a little bit more how this method is dealing with the sliding motion?
Yeah, we have used the total variation. So actually, we use that to deal with sliding motion. So we would like to allow that sliding motions by using total variation. That's the way we want to deal with that.
You're not using any masking of organ. Any more questions? If not, I think we can move on to the next speaker.